It's a leading cause of mortality in older people. It's been underdiagnosed and treated. Like many people don't go and get checked. The insurance covers it. So just wanted to know. I want to give you some information about some osteoporosis, and then I'm going to tell you today about the complications, the causes, and how do you diagnose. Like what do doctors do? Treatment options. How do you prevent? And how do you follow treatment guidelines? So osteoporosis, by definition, it's a progressive skeletal disorder characterized by compromised bone strength that puts you at increased risk of osteoporotic fracture. The common bones affected are the back bones, the hip bones, and the forearm. Just want to give you some statistics about it. About 44 million Americans, age groups around 50 and above, are at risk for osteoporosis. In that, 8 million women and 2 million men have osteoporosis, and the rest of the people, like 22 million women and 12 million men, are at increased risk of osteoporotic fracture due to bone loss, in their lifespan. And this puts a lot of economy burden, and the medical expenditure with these fractures are 6 times more than the other, diagnosis. If you look at the statistics, the most common diagnosis for hip fracture, femur, neck fractures admitted in the hospital, it's like a primary diagnosis is like 306,000. So there's a lot of volume of patients admitted with fracture, and the length of stay in a typical hospital for fracture is like 5.8 days. Which is, loss of a lot of money expenditure. If you look, the cost of one hip fracture is like 40,000. That's a lot. And the annual cost spent on osteoporotic fracture is like 17 billion. This is statistics done in 2001, what I have. And the complications are, when you get a fracture, you're pretty much you're going to get admitted in a hospital, surgery, and and you can get pressure ulcers, pneumonia, urinary tract infections, and depression is one of the things. And then some people get into disability because they don't recover well. So just want to tell you some of the complications. And there's a study in Finland. It says the hip fracture decline. This is a study done from around 1997 till 2004. Again, this changes of decline happened because people are doing healthy lifestyle, eating better. They had a good weight. The weight is an important factor, which I'm going to tell you. Taking calcium, vitamin D. These group of people took osteoporotic medicine, so then they saw on follow-up big decline in their the osteoporosis improved on the follow-up studies. That's what they meant. If you look at the causes, advancing age is one of the causes as people get older. Again, early menopause for females, like surgical menopause. They are risk for osteoporosis.
My last question.
Yeah, sure, please.
2 questions on that. There's something like in my case, I have Hashimoto's thyroid condition, so I moved into that phase earlier than most.
Mm-hmm.
Does that impact it in the same way?
Thyroid problem comes under the risk factor for osteoporosis because of the medications.
The Synthroids?
Yes. Just
Okay.
talk.
And the other question is genetics. Does genetics?
Genetics, of
The
course.
Hashimoto's I have because my father, genetically. So
The treatment of your thyroid disorder is a risk factor.
Oh.
So genetic factor, you're right. If a family history of osteoporotic, hip fractures or any fracture you have, you're going to be at risk. So advancing age, weight, like if people are less than 127 pounds, that is a risk factor.
less than?
Yeah, so keep your weight around 130.
Okay.
It's better. If you go low, it's a risk factor. And cigarette smoking is a risk factor. Alcohol, if you drink, they say it's 1 to 2 drinks is good. So 3 drinks or more is a risk factor.
Okay. And even though they keep tooting red wine, is white okay? Do you agree with you?
We all are alcohol. Everything in moderation.
I go for red wine.
Oh, okay. I like the white. Okay.
Keep everything in moderation, should be healthy. And people who get fracture, like we say it's as a fragility fracture, like they get fracture with not falling a lot, but they break easily. Age 40 or more, they're a risk factor. So they have to be checked for all these bone density tests. And secondary causes like your thyroid problems, liver disease, endocrine problems, inflammatory bowel disease, celiac disease. There's all of the risk factors. Like if you have a hypoparathyroid hormone problem, that's going to cause your risk for osteoporosis, and gonadisms, low testosterone. All those things are one of the risk factors.
Cholesterol?
No, cholesterol doesn't come.
Okay.
Cushing's, thyroid, like pituitary problems, like
Mhm.
prolactin disease,
Hmm.
diabetes, and some of the endocrine and nutritional problems are like people have gastric bypass surgeries because they lose some of the place where it has to be the food has to be absorbed. Like vitamin D, all is important, right? So if a surgery is done, if there's a factor that's made because of the surgery, they can't get absorbed well. So they are put you at a risk factor. And there's a lot of like collagen metabolism problems, kidney disease. People who are immobilized, don't do a lot. COPD, which is like chronic lung disease due to smoking. Why they are having a risk factor for osteoporosis is those patients take steroids. If you take steroids 5 grams more than 3 months, it's put you at a risk factor. Does it make sense? And talking about the medications, I'll tell you, apart from the steroids, the seizure medicines put you at a risk factor, like the phenytoin. I don't know, probably you're familiar or not. So that's one of the risk factors. Blood thinners like warfarin, heparin is one of the risk factors. Like to avoid getting pregnant, females get the depot shots. That's some of the risk factors. Asians and Caucasians are at more risk, and affects females more than the males, but males' mortality rate is more than the females. And males don't get checked, or that's one of the other things to do with that. So that's some of the.
But they won't even check you,
Sorry.
We go to like an osteoporosis clinic, we both go, and they check Maggie. They say, oh, you don't need to be checked.
I mean, most of the insurance covers, typically at age 65 for females we can check, and males 70 years and older. But if they have early menopause due to genetic, or they have a surgical menopause at 35, the hysterectomy, they can have a bone density at an earlier age. And people taking these medications, they can be checked. Sorry. Yeah.
What about diving? Like if you're a diver?
If you're what, sorry?
Diving, scuba diving,
I don't think so.
I think there's a higher risk
Of
osteoporosis.
I haven't heard about it, but I can look into it. But
Well, that's what I heard.
I'm not aware, but I can get back to you when you follow.
Because the military, they check you for osteoporosis if you're a diver.
Diving?
Military diving.
Interesting.
Yeah, they
I
do.
never heard. Okay. But I can look into it and get back to you. But typical age is 65 for women and males 70. Unless they have a risk factor, they check earlier. And most of the insurance covers.
Excuse me, are
Yeah.
you related with Dr. Soul?
He's a friend.
You like to die?
So let me talk a little bit about how do we investigate, like in a doctor's office, like the doctors like me, they usually ask histories like what are these, all these questions. And in examination, we look, that's why we check the height. If you lose like 1.5 inch, that's loss of big height. And it could happen because of osteoporosis causing compression fracture where you can lose height. So those are the things we can diagnose by exam. And then blood work we do. We check your kidney, liver test. We do a urine test for calcium. We do check for vitamin D, thyroid test. Those are the common tests we do. Then we do the bone density test. And then we have some T-scores that we look into it to diagnose. If it's T-score is like 1 to 1.5 is like low bone density. If it's 2.5 and lower, it's osteoporosis.
It's what? If you do what?
We do the bone density for to check for osteoporosis.
Mhm.
The hip and the spine, those are the two places they check. We get a scoring report depending on which we treat the patients.
And how do you do the test?
I order it and they go to the radiology. And they do it.
Oh, is it an MRI? What is it?
It's like an X-ray, but they focus on those particular places alone. The
Okay,
hip and the spine,
okay.
because those are the common places.
And that test is different than the bone density?
That's what we call as a DEXA scan.
Oh, okay.
The bone scan, those are different. This is called DEXA scan.
DEXA scan?
Scan, yeah. The other test too, but this is the one that gold standard we use. So that I see in my practice this patients with lung disease on steroids for a long time, and usually we'll give them the lung doctor. That's why you have to be careful, because those patients we should do the bone densities to look for baseline. Try to see if we could stop it, because you get bone loss. And other people who take steroids are people with other diseases, like like some arthritis issues. The doctor gives different indications, but we have to keep an eye. Everything weighing the risk and the benefits. But usually the docs order it if they're on steroids for a long time.
Mm-hmm.
So you don't need to fit in that age group like 65 for females. You can do it well ahead.
Mm-hmm. And so you have a magic pill that will fix it too? Can you give us a magic pill?
Yes. So, so before the treatment part, I like to talk about how do we prevent it. Preventive is like healthy lifestyle, eating. Like I've given you the foods rich in calcium, vitamin, which is very nice. Calcium, we recommend like 1,200 milligrams of calcium a day. Again, you don't need to take it in a pill form. You can take it from the foods you eat, and then if you don't make up enough amount of calcium per day, then you can take the supplements. So I have like information for you. You have it with you. How much milk has. It came to 2% of whole milk of 8 ounces has 300 milligrams of calcium. So that gives an idea. Yogurt 6 ounces has 250 milligrams. Orange juice. These are the common foods. So orange juice has like 300.
How do you know if your mushrooms have been exposed to ultraviolet light?
Sorry, mushrooms?
Yeah, the third one down there on the front page, it says mushrooms that have been exposed to ultraviolet light to increase vitamin D.
I'm sorry.
She's on a different page.
Yes. Yeah, I
Page
just see that.
24.
I typically assume all mushrooms are,
Oh, they all are?
yeah.
Pretty well,
Okay.
because they grow them underground.
Yeah, so I don't know why that particular line came. But this, I'll finish this calcium, sorry. So apart from the milk, yogurt, orange juice, like the information I given, beans, half a cup of cooked beans have like 60 to 80 milligrams of calcium. That's good to know. Dark leafy vegetables, half a cup of cooked vegetables have 50 to 135 milligrams of calcium. Almonds, like 25 whole almonds have like 70 milligrams. Orange has one medium sized orange has like 60 milligrams of calcium. That's good to know. Cheese, 1 ounce has 195 to 235. And again, gotta be careful with the fat in the cheese. You could find the low fat cheese better.
One question,
Sure.
your opinion,
Yes.
professional opinion. If you don't eat all of these great things in a balanced kind of way, but we're taking all these vitamins, multivitamins, calcium, magnesium, vitamin D, whatever every day, is it helping us? The vitamin supplement.
See, I'm not for vitamin D, we have over-the-counter vitamin D. So talking about vitamin D, I like to tell a little bit in detail. Vitamin D is produced in the skin with help of the sun.
Mm-hmm.
Why vitamin D is important? Because the calcium you take, it needs a carrier, which is vitamin D, to go to the bones. So your bone is strong.
Mm-hmm.
So if your vitamin D is low, it's not going to go to the bones. It's going to go to the trash. You know what I mean? So you get bone loss. So most of the people, I mean, they say vitamin D is deficiency common and people are not exposed to sun a lot. You know, Floridians we should not have. But, you know, we do see vitamin D low, but it's more common and people are not exposed to sun a lot. And there's vitamin D rich food.
But my real question is, if you're taking vitamin D supplements that we get here at the drugstore, are they helping us? I mean,
If you're deficient, you need
I
to.
must be taking
I'm not a
10 things a
fan.
day. Is it helping me?
I'm not a fan of all these supplements. I pick on all these important ones. I like the calcium, the vitamin D.
Okay.
You know, I like vitamin C.
Taking the
Yes,
pills.
or just take a multivitamin for other condition. You know, generally for health reasons.
So it's not hurting us to take that, but it's also important to worry about what we're eating
This
in our
vitamin
diet.
D is separate on its own. The deficiency of vitamin D is separate because the multivitamin doesn't have enough vitamin D in it.
Right.
So
So you take the multivitamin, you take vitamin D supplement, you take C, you take calcium.
I mean, if you eat fruits, vegetables, everything in balance, you don't need all supplements. You know, like going to the GNC and taking everything. I believe in it. But the things I check in my clinic are the vitamin D along with your preventive blood work. And if it's low and patients are already eating well, you know, it depends on how low it is. If it's slightly low,
Mhm.
1 point less than 30, then I tell them to take over the counter. Over the counter, it's very cheap. It's Walmart, Target, you know, pick whatever brand you want.
Mhm.
Remember the number 1,000, okay? Don't get scared, 1,000 means. It's 1,000 international unit. It comes in a small capsule, you won't choke. It's very small, green color. So that's our medicine I tell the patient to buy.
Mhm.
And
You know,
then
like fish oil.
cod liver oil has good vitamin D, 1,360 international
No, those
unit.
fish oil capsules. You don't like those?
I mean, you can take if you tolerate it, but the cod liver oil has particularly, you know, more.
Doesn't taste very good.
Yes. But why can't you eat fish if you like fish?
No, like fish.
You don't like fish?
Excuse me, I'm not in favor of vitamins. If doctor tells me, take it, maybe I take it. But otherwise,
Why?
So
Why?
so the thing
this
is,
is good for you, this is good for
so
you,
if
this
you
is
eat
good
a
for you, this is
balanced
good for you.
food, everything in portion control, you're going to get all the nutrients from your food. And at 50 and above, it's personal patient's choice. They want it, not a bad idea. Need to take a multivitamin, one for female, and then they have one for male. But taking separately, you don't need to. If you ask my expertise, that's what I would say. But vitamin D is separate. If you're deficient, over the counter you need to take 1,000. Or if it's really low, like 3 or 8, you know, I prescribe like 50,000 units once a week for 8 weeks, and then the patients can take the over the counter.
Mhm.
But for your question, you don't need to take every little mineral separately. If you want, you can just take one woman once a day multivitamin. But if you're deficient with this, you need to take extra supplements.
Mhm.
If doctor tells me I need it, I take it.
And
Otherwise,
eating a little bit of fruits, vegetables, find the ones you like. You
and
know.
I try to eat good food.
That's good. Nice to hear.
Yeah.
Because if you don't eat enough fiber from fruits or vegetables, you're going to get constipation. So you might hurt, you know. I mean, when taking supplements. Okay, coming back to vitamin D, I just wanted to give you the paper to showing how much of vitamin D is at each all these food. Egg has 25 international units, which is found in the yolk. Cheese has 6. Liver has 46 international units. Orange juice with the 45 with vitamin D has like around 100 units. Yogurt has 80. Tuna has 154. I see the salmon is pretty good in vitamin D, 800.
Mhm.
And And the cod liver oil, if you could tolerate it, it has like 1360.
Excuse me.
Yeah.
I go to the doctors and they never tell me take this kind of vitamin. They check me what I have, how my health is. They check and they never tell me take this kind of vitamin, use this. And
I don't do. For my patients, if you look, I mean, yeah, I've seen you a few times, but I don't recommend. I mean, I don't check for a lot. We have to do what is evidence-based medicine, check what is needed.
what's needed, yeah.
So studies have shown about osteoporosis is so common. So causes, I've told you, vitamin D is one of the, causes. So it's easy to fix it, right? So we check
vitamin D.
I check vitamin D.
Osteoporosis.
Yes, because as I told you, you need vitamin D is produced in the skin with the help of the sun. If it's low, you need to take a supplement so that the calcium gets up. So vitamin D acts as a carrier for calcium attached to it. Then it goes to the bones. So the bone is strong. If you're low, calcium doesn't go to the bone. It goes to the wrong place, to the trash. So that's why vitamin D.
Yeah.
And it has other lot of health benefits, vitamin D. And it's very
I
cheap.
take a fish oil.
Mhm.
That's good for the heart.
And I will check your vitamin D when you come and see me.
Okay.
I do it for everyone. Everything-
When I go to the lab and kind of blood test,
uh-huh.
and then whatever I need.
It's pretty much a basic workup for my patients. I order vitamin D because I see so many. 99% are low, and then 1% that's normal. I'm surprised, and they don't take supplements. It's just interesting. So that's. But most of them, even I'm low. But it has good health
If
benefits.
you spend an hour outdoor a day, that should be enough, right?
Yes, very sunscreen. Okay,
Can
so
you use LabCorp?
we have our own lab here, and
Here?
we check it. Yeah,
Oh,
we do it here once a week, and then we send it to our main labs. So I told you about the some of the foods, and okay, prevention. How do you prevent like healthy lifestyles, watching healthy diet, calcium, vitamin D, exercise? Try to do at least 30 minutes, 3 times a week. You don't need to do a lot, like at least like a little bit of weight lifting, like it strengthens the bone. And little weights, bone strengthening exercise, those type of things. Studies have shown that it improves your bone strength. Fall prevention at home, if you do exercise well, your bones are strong, your muscles are strong, so you don't fall. So that helps. Make sure the runs are very that's some of the common things in Florida. Rugs are loose, so they slip and fall down. So make sure they're properly.
Before I got sick, my arthritis, my left hip, I was going to the gym every 7 days a week.
Wow.
And look at me, I was 160 pounds, now I'm 130. And when I was 160, I was going to gym 7 days a week. There's a machine, leg press. I pressed 600 pounds up and down, 30, 40 times up and down with my legs.
You enjoyed it?
So, 600 pounds.
Very good.
I'm sure that's your secret of your longevity. Yeah, you can see that. You look good for your age. So rugs, make sure that it's properly fixed. Put rug pad, it's secure. And then make sure that there's proper lights at home. Like nighttime when you get up, you don't want to trip and fall. And again, dogs at home, pets, you don't want to trip and fall. That's because it's very easy to break when you have bone loss. You just need to fall to break it. Let's put that way. And people, when they have a second floor house, they can pile up things in the staircase, and then they can trip on it when they climb. You know what I mean? It's hard to go back and
It
forth.
happened to me about a few days ago. And there's a door, open the garage door, and then there is door to the house. I open the door and
So you gotta be careful. Wear sturdy shoes. Again, you don't need to worry about like the snows here. That's a big headache. People falling. I'm from Boston, so people falling, slippery. So that part is good. don't need to worry, but make sure that nothing is slippery, clutter is free at home. Get your vision checked, which is good for driving and also at home. So, and talk to your doctor about medication that can make you dizzy. See, everything happens at night time. When you get up, you feel dizzy. Some of the blood pressure medicines makes you dizzy. So make sure that you have symptoms that something. Again, these are the preventive things to avoid a fall that prevents you to getting a fracture because it's very easy to break a bone. So
What about low dose aspirin for
aspirin is good.
osteoporosis?
Not for osteoporosis. Generally, for your health is good. But for what I was talking is that there are certain medication that makes you dizzy, you'll faint, right? And it's easy to break a bone. So talk to your doctor. Doctors usually want to talk to look into it. But most of the time they look at medication. Medication is a common side effect, so it's easy to make sure that you don't take a lot of medicine, cut short of medication list, because there's a lot of drug interactions and things like that. Coming back to your thyroid medication, you have to take because the thyroid is here and there, it'll affect your heart, weight gain, weight loss, so many things happen. But all you have to do is just follow up with the bone density every 2 years to see. And
What do you think of Arthrotech? I take that.
Arthrotech is for arthritis. That should not cause bone loss, but make sure you take it with food so it doesn't affect your stomach. It's like an anti-inflammatory for your bone.
It works for me.
That should not cause bone loss.
Okay.
Steroid is a big key causing bone loss. And to make sure if you're smoking, try to cut down smoking. Keep your weight around 130. I like that number. Because alcohol 1 to 2 drinks a day. So whatever wine, pottery control, calcium. As I told you, if you don't take total requirement is like 1,200 milligrams a day. So if you take enough from the food or drinks or orange juice, you can take rest from the supplement. I like calcium citrate, less constipating, bloating effort. You can take it even if you're not eating. Then the calcium carbonate. Maybe a little expensive, but it's worth it.
Dr. Mandela?
Yeah.
Orange juice. I am diabetic. And orange juice is very sweet, naturally, and no sugar in it, just natural. And is it good to drink it?
I don't think it's bad. For your diabetic diet, it has to be 1,800 calories. Your diabetic diet is 1,800 calories a day. So if orange juice, if you drink a little, that doesn't hurt. It's total calories. But don't drink a lot of orange juice or a lot of banana, everything.
Everything in moderation.
Or you can eat a whole orange also instead of the juice because you have the fiber. Fruits are better directly.
So what do you think, what's your opinion on organic versus not organic?
I buy from my house regular grocery, non-organic. If it's on sale, organic. Nothing big preference. Organic is better, but
is it really? I mean, how do we know what they're really?
Because of the chemicals.
The chemicals
they claim, but
pesticides and things. But I use regular vegetables instead. I don't go to the organic aisle unless the price is all the same. But I make sure that I do other healthy lifestyle changes in with me. So the bone, I told you about the bone density, the prevention, and then the treatment. We have bisphosphonates. You have heard about Fosamax? Fosamax.
What's Fosamax?
It's a brand name, but it's a medicine for osteoporosis.
What is
bone loss.
I've never heard of it.
It's for bone loss. It's been there for a long time. It's also called aldronate. Let's talk about it.
You have to have a prescription or you buy it?
Yes, it's a prescription. Good question. You need a prescription. And you can take once a day or you can take once a week. Important things with these medicine, you need to fit the criteria for who needs the medications. So the doctor will decide who has to be treated, who can be watched. And then that's the favorite medicine for everyone. Aldronate, which is also called Fosamax, different brand names. I'm a generic person. I just use a generic. whatever that's available.
Mhm.
Once a day. Important things with these medication, it has to be taken first thing in the morning with an empty stomach, with a big glass of water, and you need to be upright. You should not be lying down for 30 minutes. Why? Because it'll upset your stomach. Those are the things. It's important. Should not
Any
take
side
any-
effects?
Side effects, not much, but this medicine has to be taken away, otherwise it will upset your stomach and other things. Another medicine is we have is like Boniva, like every 3 months, IV injections, and there's something called IV
What is it?
Boniva.
And it's injected?
You take it comes in oral and IV, but usually I do only oral. It's once in 3 months. Depends on the insurance coverage. This is all based on insurance. I will like Boniva, but if the insurance doesn't cover, I go with Aldronate. And they're pretty good with, even if it's once a day or once a week, the prices are pretty good. And they come, certain things come with vitamin D, which is good. You don't need to take extra vitamin D over the counter. So there are different options. And there's something called acid, which is an IV infusion for people. Once a year they do it, and they five I told, and then they can stop it. And then we can, again, every 2 years we can do this test to see if it's getting better. Like I'm talking about the DEXA test I told you. And the people who go for the IV infusion, the one I told, the zoledronic acid once a year, they can stop after 3 years. And then they can follow. If it improves, getting better, they don't need to be treated further. So it's not a medicine that you need to take for lifelong. You can stop at some point and follow. So, and the dentist will be on the top of that, these medication because of the procedures with jaw necrosis. They might need to hold off for some time, and that's okay.
Doctor, they found out I had pain on my hip and infection disease. Doctor, she found all kind of how they call it? What kind of was affecting me? How they?
So you saw the infectious disease doctor for your thing?
Yeah, and
what did they do?
they put the IV to me, and it was they're ruining my kidneys. They stop doing it.
I won't be surprised because it's probably a strong antibiotics like Manco or something. Some of the medications, antibiotics, stronger ones affect your kidney. That's where you keep an eye on your kidney. Because you have only 2 kidneys
Yeah.
and 1 liver. Be careful what we give age-wise. What is your baseline kidney function?
And now they start giving me antibiotics.
And you're fine.
That's it.
I need to check your blood test for
And
that kidney.
now they said it's chronic. It's arthritis.
You have arthritis?
Yeah.
Okay. And your kidney is fine? Okay. What, do you have questions?
And I have pain once in a while,
Mhm.
and I have to go to the pain management doctor and see what you can do.
That's for the back pain.
Because they told me I have infection, and it's for a long time. And if I heard people who have a problem with their hip, they make a surgery on it. And they told me if I have infection all the time, they cannot do surgery.
Which is true, right? Surgery is when you sign the form for consult, you sign that risk of surgery, bleeding, infection, that everything.
I don't know.
So when you have an infection, they won't touch you because it gets more complicated.
It's if it's no, it's not the rough. If it's if it's not smooth, they could push something like balls, something. I would love like that, but they said if I have infection, they cannot do it.
And we need to get into. I mean, you look fine now.
I would find I used to run.
But you know, they try not to do surgery, and you know, if something they can do fix by medication, they fix it with medication. Surgery is the last resort, right? So if they have to do, they will do for you. If they control the pain management, they will still control that. Of course, if you have infection, no one will touch you.
Yeah.
I mean, you need to put some parameters, criteria of clearance.
But for the pain, maybe they are doing something.
Yes. I think as long as your lifestyle is comfortable, pain-free, you can do your daily activities.
Yeah.
That's the main goal. And if you can't do with this pain medicine and everything, then surgery. But you have to weigh the risk and benefits, your age, how much you can do. Because remember, like as I told you, with the fracture patient going to the hospital, so many things happen. Fracture is easy to fix, but sometimes some other unfortunate people, they get pneumonia, urinary tract infection, they're bedbound for a long time, so they're going to get pressure ulcers. You know the pressure ulcers I'm talking about, the bed sores. It takes a long time to heal. You know, then you're going to sleep like that. So it's going to be they need water beds, so much, attention they need. That's why we try, this topic I'm talking today is to prevent these things to happen. You know, we all like our patients to be healthy, happy.
I would like to find out how my bone, blood density of my bone.
Definitely we'll order that. We'll fit into the age group that we can order it. And, of course, yeah.
What about motion? Does that affect osteoporosis?
Motion won't affect. Just be careful with motion, it will upset your stomach. It's a good medicine. Make sure your kidney function is good. And then take it with food.
Right.
Without food, if you take it
But it's like 900 milligram caps, they don't, I mean, if you just take it once in a while,
I mean, go with like 400 or 600 for you as needed.
No,
The maximum dose for single dose is 800 milligrams if your kidney
800,
function is working good.
well, just have
You don't need to take the maximum dose each time. You can take 600 and see, but the maximum total day is 2,400 milligrams a day for a person with a nice kidney baseline test is a normal range.
Yeah, well, I couldn't think of what kind of bacteria was, what kind of infection of bacteria was affecting.
On the time when you have
She found what kind of bacteria was affecting that infection of my hip. But what kind of bacteria, and then she described the IV with antibiotic, but it was just in my kidney.
affecting your kidney. I feel like you had a strong antibiotic. Because remember, when you have hip problem, infection, it's a serious thing. You don't want to miss, because the next thing they go to the blood and you get septic, that becomes very nasty. Then you have to be ICU. So many things happen. So they have to be a little aggressive with certain patients, or they get really strong. That's why those type of antibodies, we monitor it. We take a level every day, something to do, make sure that you're on the right dose. Do you have any questions, my dear?
I kind of have a different situation too. I have a fusion in my back. And so it puts pressure on the spine, and I've got all this stuff going
Was
on.
it for the herniated disc you had some issues?
No, it wasn't an accident. It was, so I have a fusion. I have metal in my back. And it just, puts pressure above and below, and I do have this other stuff developing,
Have you ever had a bone density test?
Yes, and that's the joke to me, is I'm in the right reading for
How
that.
old are you?
No, I'm never. I
Okay,
forgot.
So they told it was normal, huh?
They told me to kind of keep an eye on
Is
the
it
right
bone-
hip.
is
She
it
told me to
osteo-
walk. They told me to walk, but I'm just saying that, how could that be so good when my spine is falling apart?
I mean, that is a different problem for which you had as fusion, okay? But you definitely need a bone density.
Yeah.
I don't want to know your age, but
It was okay. No,
because
the
you're
bone
on the
density
thyroid
readings are-
medication itself, you qualified to be checked earlier.
But but I'll just say that the MRI readings that I've recently had, my spine is falling apart. The
That
disc.
is based on MRI. Then they do the DEXA scan for this osteoporosis. This particular test is the test for
And I'm going
osteoporosis.
to, okay.
You need to ask your doctor. You're going to follow up with me. I can review your DEXA scan. That is the test we need to be looking for, not the other ones. The other ones you did it because you had other issues. This is bone loss, a different entity on its own.
Well, they're noting bone loss too.
So yeah, again, X-ray
Disc
picks up
bone
too.
loss.
Like when we do back pain X-ray, they pick up the compression fractures and things like that.
Yeah.
For scoring, these tests are better.
Could I just ask you, who is MAXhealth? I happened to be over there, saw you, walked in, looked around, you're new, saw this lecture series, which is great. Who's MAXhealth?
I'm a MAXhealth employee. I'm working here for 2 years. MAXhealth has clinics like this in multiple places.
Okay.
This is one of the places. They have one in Beach, Sarasota, and in Bradenton, Ellington, and Lakewood Ranch, and Manatee. And they have a lot over that side. Most of the clinics are primary care. They also have oncology, dermatology in our MAXhealth office. Village, which is 10 minutes from here, we do our own labs, ultrasound, CT scans.
Oh, you do?
Yes, we do pretty much a lot of, and patients like it, and they do everything in one network, because we do, results all come sooner. We have our own dermatologists, cancer doctors, so it's pretty, we have a lot of people here, but more primary care.
Okay, I'm from up north, but, so you're kind of like an intercoastal?
Pretty much like that.
Similar. Okay.
Where are you from? North?
Maryland, DC.
DC, so you don't miss the snow. I lived in Boston for 14 years. So Boston is
My
nice.
father's from Rhode Island, you spent time there.
Yes,
too.
I did my first year over there.
Well,
Pretty
could I
nice.
ask you said you were an observer in neurology. What did that involve? I mean, a neurosurgeon is who fused my spine. So what do you bring from that perspective?
I had an opportunity to work as an observer in the neurology at the University of Massachusetts. I was a movement disorder doctor. It was a nice experience. I need to, I rotated like a couple of observation. That's everything. It helps me. Like I see my patients here with Parkinson's and Alzheimer's, so I had some experience with that.
Interesting.
That's one thing I got to do my observation. But I had a wonderful opportunity working with a movement disorder doctor, because it helps me a lot. Not everyone gets that opportunity. If I had more, I would have did my rotations in a different other doctors too. But that is a bigger program, University of Massachusetts. I did work with them last.
Well, where I come from, it's Johns Hopkins. And Johns Hopkins kind of taking over everything up north.
Yes.
And the neurosurgeon was at Johns Hopkins.
Wow. Okay.
So, but Anyway, so have you figured out how to order new spines for us? Huh? I'm asking everyone.
Sorry?
Have you figured out how to order new spines for us? New spines. new
Spines.
hips. Somebody told me it was on back order. at
I wish so,
Costco.
right? I wish so. Why not? Why can't people
You're telling
live
us
like that?
how to live better and longer, but I think we're gonna need some
They do
help.
a lot of bone marrow transplantation. You take your own blood and heal. They centrifuge take care of your for hair issues, hair loss. So many new things are coming.
What do you think about stem cell?
Knee things also, something like
What
that
do
they
you
do.
think? What do you think
It's
about it?
it's
New
advancing. Technology is advanced. Your own body is helping you.
Mhm.
They take and they do something and they inject your body. Awesome, right?
Mhm.
What does that's going to be definitely working because it's your own cells.
Mm.
Of course, yeah. But spine, I hope so. It's like buying a ladder from Lowe's.
Yeah. Okay.
I think so. That's why. Who knows? Everything has to be FDA approved. Trial has to be done. To do it in America, it's going to take It has a lot of studies. We have to prove hurdles. Who knows what is there? So many things are coming. All these robotic surgeries.
Mhm.
I mean, it's been there for a while, but I'm just telling you, so many new things are there. And then the insurance has to clear. That's the biggest hurdle. My dear, you have any questions? You've been silent for a while. Are you hungry?
I am getting hungry, but I heard that osteoporosis doesn't have any symptoms.
Of course.
So that's true?
Yeah.
So if your hip hurts, that doesn't mean it's osteoporosis. It means it's something else.
Hip hurts. As I told, that's why I told you all the risk factors, the causes. Like doctors do at age 65 and above, but if you have medications like thyroid, steroids a lot, or early menopause, back pain. Again, doctors won't jump on tests. They'll reevaluate if it's not getting better. They will do it. Bone density, you'll qualify for it. But of course, the symptoms won't happen because it's like holes, as I told you. The holes are going to take time to develop. When will you have pain? This ladder breaks, and then you have the pain. Slow pain. You won't get like a car accident type of pain. Slowly it comes. And depends on your threshold of the pain and when you want to see your primary care doctors to get checked.
Dr. Mandela, my pain, why is this? It's
The hip pain.
but bone.
That's what I don't. I need to get your records, my dear. I need to see what are the tests you did. As I told you, it takes time for the records to come. So then I'll make my own assessment. I believe what you say, but then I have to make my assessment based on the findings. Same thing with your bone density. If I read it on my own, only I will know what the doctor communicated to you. He might have told your normal bone, like there's a different terminology. Osteoporosis is the advanced. That you could be in the lower part, osteopenia or bone loss. Maybe he presented to you different, I don't know.
How often should you have it done, the test?
Insurance, 2 years should be fine.
Every 2 years?
No need to repeat less than 2
Okay.
years. And you don't need to. And insurance won't cover, and it's a waste of money to do that.
And I have constant pain, but it's 2, 3, it's bearable. And sometimes, I don't know, it's timing. At night, 10, 11 o'clock, for 1 hour, I can stand it. It's unbearable.
The hip,
Yeah.
that's what I'm saying. We need to look into your records and see, and I have to order your bone density test. And then we have to go from there. Again, it will be 2 different problems too.
On February 2nd, I'm going to see a pain management.
The one the doctor gave me, tried to reach.
Yeah.
And then I'll have better answers once I get your records. So was it informative today?
Yes, thank you.
That's why most of the time people have struggled knowing how much of calcium and vitamin D is there in the foods we eat commonly. That's why I try to get that information, and that's from a nice source, the one I printed. And please look into it, and then if you have any questions, you can contact me. Thanks for your time.
One other question, since you do other seminars and I see you're filming this, can you click in, log on, and watch the other things?
Yeah, live. We're live. That's why I have your information. I want to talk to you after we're finishing.
Okay.
I definitely want to speak with you.
Okay,
So I
that
had-
back pain one. but I don't even know where Ellington is.
I'll show you. I know where it is. I want to thank Dr. Mandela for coming, and thank you so much for this.
Thank you. Thanks for admiring and listening. I enjoyed all your
I'm
questions.
the one,
If you have any questions, you can contact
you're
me.
down with my heart.
I have the information here, but I don't have the name. I can get the name there.
I switched, I didn't, oh, I see it is.
Yeah, and then we have your email there?
Mm-hmm.
Perfect, okay. Because we have another event that's coming up on Thursday, all for the rest of the week.
And you can also give your favorite topics, what your dog